Okay. Which of the following is the most likely underlying pathophysiological mechanism in this patient? Abnormal collagen deposition, autoantibody-mediated inflammation, immune complex deposition, neutrophil infiltration, or overproduction of melanin. A 60-year-old man presents with a 1-year history of progressive skin thickening and tightening of the extremities, face, and trunk. He also complains of Raynaud's phenomenon, acid reflux, and shortness of breath. On physical examination, the skin appears shiny and taut, with loss of normal skin markings. The patient also has sclerodactyly and telangiectasias. Which of the following is the most likely underlying pathophysiology mechanism in this patient? So he has Crest syndrome, which has all these things, or just like scleroderma. Um, so I actually don't know if it's like 100% if it's um, diffuse or if it's just or if it's a systemic. But I know it's Crest syndrome, and I think with Crest syndrome, it's going to be abnormal collagen, autoantibody-mediated inflammation, immune complex deposition, neutrophil infiltration. It's not overproduction of melanin, so I'm going to go ahead and get rid of that. I think with this, I always think about like anti, oh my gosh, I forget the antibodies exactly. What's this? I'm blanking. I don't know why. I feel like I know
Okay.
this.
So what kind of disease process is CREST?
Um, I'm kind of confused. What do you mean?
Like, is it infection? Is it autoimmune?
It's
Is it
autoimmune. It's autoimmune.
okay? So then what do you want to go with here?
Um, autoantibody mediated inflammation.
Okay, that's what I would have picked, but let's see kind of what they say here. Abnormal collagen, progressive thing, Raynaud's syndrome, Crest syndrome, mechanisms, scleroderma, abnormal collagen fibrosis to the skin.
Yeah,
Is prime mechanism abnormal collagen? Not. Oh, interesting. I didn't know that. That's something new I learned. Okay, that's kind of me personally, right? That's how I would have picked it. For some reason, let me make sure. Hold on. Let me fact check this question because in my mind, I feel like it's an autoimmune to anti-centromere or something like that.
yeah. Anticentromere is the exact antibody.
Crest syndrome mechanism of action. Let's see. Oh, there. Let's see. That's the antibody for it, but let's see kind of. Oh, it's associated with detectable antibodies against centromeres and usually spares the kidney. If the lungs are involved, usually this cause. Interesting. So okay, so this is kind of interesting here. So they're asking for the pathophysiological mechanism. So there is like associated antibodies against those, centromeres, but they don't know
Hmm.
the exact like pathway. Does it make sense? It's like, oh, we do find these antibodies, but that's not the exact like mechanism of why you get these. The direct mechanisms abnormal collagen deposition, which is why you get kind of the sclerodactyly and things like that, but they don't know exactly kind of because it attacks the anti-centromeres, they don't know how that directly causes the symptoms. Does it make sense what I'm saying?
Makes sense. Makes
Yeah.
sense.
So I would have picked B, based off of this is actually ironic here. B is based off I remember the anti-centromeres. A would be more of like you're actually answering the correct question, as in like, oh, how do you get your symptoms? So it's more
Makes
direct,
sense.
better answer. So yeah.
Yeah. Okay. Cool.